Hi, my name is Maria Sanchez, and I will be presenting on the female orgasmic disorder. To start off, I am going to talk about the three types of orgasms that females can have. The first one comes from the skin gland, as shown in the image. It is also known as the G-spot for women. It's located in between the bladder and the vagina. During arousal, the skin gland will engorge with blood and nerve fibers will become sensitive. Enough stimulation to this area will create an orgasm. An orgasm coming from the G-spot is not the same as a clitoral orgasm. The G-spot is completely inside the vagina, while the clitoris is located in the vulva and carries inside the vagina. One can reach a clitoral orgasm from physical stimulation. And lastly, a cervical orgasm can happen through deep penetration. So what is the female orgasmic disorder? According to Ducharme and Goldstein, it is a persistent or recurring difficulty, delay, or inability to attain orgasms following sufficient stimulation and arousal. The problem with this is that it can cause a psychological anguish in the female, and this can lead to relationship problems in the long run. According to International Society for Sexual Medicine, female orgasmic disorder affects 16 through 28% females in the US, Europe, Central and South America. It also affects 30 to 40% females in Asia. The female orgasmic disorder is the second most common sexual dysfunction for women. The symptoms of this female orgasmic disorder is not being able to orgasm, having a difficult time orgasming, or having unsatisfying orgasms. From a psychological point of view, it is very possible that women may have a difficult time reaching climax during sex due to the comfort and trust level they have with their partner. It also includes the emotional feelings they have towards them. Many women have been conditioned to think that finding pleasure in sex is wrong, so many will hold back. They do not allow themselves to fully relax and feel comfortable with their bodies. Natural reaction to sexual stimulation. The feeling of guilt can lead them to also hold back during sex. According to the sex therapist, Dr. Stanley Ducharme, if a woman has gone through distress in her life, like psychological trauma, including mentally or physically harmful relationships, depression, anxiety, or psychiatric disorders, they will find it difficult to reach an orgasm. The physical causes of female orgasmic disorders include substance abuse, certain medications such as depression pills, antipsychotics, drug for cancer patients, high blood pressure, heart disease, birth control, etc. If a woman has medical problems such as vascular diseases, diabetic nerve damage, multiple sclerosis, chronic pelvic pain, or other conditions, they can experience difficulties to orgasm. Sometimes, issues such as sexual inexperience, not knowing your own body, and how to reach an orgasm can make it difficult. It is important to communicate with your partner to make sure they understand what your body likes and dislikes. Another important factor to consider is that after menopause, women's estrogen levels decrease. This means that their sexual responsiveness will change. After menopause, the level of blood flow to the pelvic region will dramatically decrease. It makes it more difficult to produce enough sensation to the genital area for an orgasm. It is very important to know what is causing this dysfunction in order to find the correct treatment. When couples are not good at communicating with each other, it is suggested they do couples therapy. They can learn to communicate with each other. A therapist might be the perfect mediator to help them work through any relationship issues that they may be going through. Sex therapy can help guide couples or the female to learn new techniques. This can include teaching a female how to masturbate effectively to reach an orgasm on their own or with the help of a partner. Being comfortable with yourself is truly important. If the problem is due to certain drugs that the female is using or a certain illness, it is important to find this out through professional help and treat it accordingly. Thank you for watching this presentation. I hope you were able to learn something new and just find it informative.